It's time for Morton in the Morning on WVBF, a weekly get-together with your friends at Morton Hospital. Coming to you every Wednesday at 11:05 a.m., Morton in the Morning brings you full access to the latest hospital news and health information. Stay in the know about important health and wellness topics, new doctors and services, and upcoming events. And get to know the team at your community hospital. And now, Morton in the Morning.
Good morning, everyone, and welcome to this week's episode of Morton in the Morning. I'm your host, Julie, and we are coming to you right here from Morton Hospital in Taunton. We come to you every Wednesday at 11:05 a.m. right here on WVBF, your hometown radio station. So thank you so much for joining us today as we near the end of April, believe it or not. We hope everyone had a very nice Patriots Day holiday, whether you had the day off or if you were working. So this episode, we're actually going to do something a little bit different. So we are going to replay an interview that we had recently done with one of our specialists, Dr. Nicole Pecquex, who is a bariatric weight loss surgeon here at Morton Hospital. And the reason we want to replay that interview is because we thought it would be very timely for two reasons. So first, with the summer weather coming, weight loss can be top of mind for so many people. So we want to introduce you to our bariatric surgery program here at the hospital and give you some information about both medical and surgical weight loss options available at our Center for Weight Control, which is right across the street from Morton Hospital. And then second, because we, over the weekend, actually just received a very exciting announcement about our program. And that is that we have officially been received notification that we are now accredited by the American College of Surgeons as a Bariatric Center of Excellence. So very exciting. This designation was made possible due to our meeting standards of the Metabolic and Bariatric Surgery Accreditation and Quality Improvement Program of the College of Surgeons, of the American College of Surgeons. And the results are in follow-up to a survey that we had here at the hospital in December, where some surveyors, reviewed and assessed our program and what we have in place and making sure that we are following all of the quality and safety measures for our bariatric surgery patients. And our team has worked so hard, and we're so thrilled that we are now officially a Bariatric Surgery Center of Excellence. So congratulations to our entire team at Morton Hospital. A lot of hard work was put into that. And we're excited to continue to grow our program. And we'll hear a little bit more today from Dr. Pecquex about our program, including the team, including a new bariatric surgeon who has recently joined our team as well. All right, so let's jump right in. Today, we are happy to be interviewing Dr. Nicole Pecquex, who is a bariatric weight loss surgeon here at Morton Hospital, and she is also the surgical director for the Steward Centers for Weight Control. So happy to have you. Thank you so much for joining us, Dr. Pecquex.
Thank you so much, Julie, for having me. I really appreciate being here and being able to tell everyone a little bit about our Centers for Weight Control.
Great. We are looking forward to it. I have a lot of questions for you, but let's start by just having you talk a bit about yourself and your background.
Sure. Well, as you've already stated, my name is Nicole Pecquex. I'm a bariatric surgeon. But interestingly, I grew up around the Taunton, New Bedford area. I grew up in New Bedford, Mass.
Nice.
And was born and raised there, and then went to New Bedford High, which was a wonderful experience, and then ended up at Tufts Medical School ultimately, and then into Boston for my residency at St. Elizabeth's, and a specialty fellowship out at UMass specializing in bariatric surgery for an entire year, which was an amazing educational event. And since then, for the last 18 years, I've come back to the Steward system and have been building centers of excellence so we can make sure we take excellent care of all our bariatric patients locally and in their neighborhoods so they don't have to travel all the way into Boston to get excellent care.
Wonderful. And it's been a couple of years since you've been with the Morton team now. Is that correct?
That's true. I've been with Morton for a little over 2 years. We recently had our site visit for accreditation to become a Metabolic and Bariatric Surgery Center of Excellence. We're still waiting for the formal word of our accreditation status, but our visit was quite excellent, and we are very sure we're going to get approval hopefully in the next few weeks.
Excellent. Well, I'll definitely want to ask you a bit more about that as well. But to jump back, what initially interested you in bariatric surgery?
Well, I have a long personal family history of obesity in my family, so it's been a subject of interest as to seeing family members struggle with diabetes and hypertension and all the problems that come with obesity, and watching them try to seek help and ultimately, after their journey, finally coming to bariatric surgery, and that's where I kind of first heard about it, and then in residency as well. And then in seeing all the benefits that patients can get after bariatric surgery, for me it was pretty stunning. We'd see people come in, high blood pressure, sleep apnea, diabetes, cholesterol, and then they'd have surgery, and 3 to 6 months later they were coming back and they were sleeping without their CPAP and felt so much better. They were off their high blood pressure medications. Some, if not all of them, were gone. They were coming off insulin and only on, say, metformin or some other oral agent. Some completely coming off all their diabetes medications. And a lot of patients seeing a much easier time balancing their cholesterol and able to come off medications from that as well. Not to mention the joint relief they get. A lot of people would come to us and have bad knees or hips and really have a hard time exercising, which really kind of perpetuates the issue of having too much excess weight. So in seeing them come back, and it's really amazing because they'll come back and they'll say to us, well, I'm running my first 5K a year out after surgery, and they look and feel amazing. And there's no other place in surgery that I've seen such an amazing turnaround in so many comorbid conditions. Yeah. So that's why I fell in love with it.
That's great. It sounds incredibly rewarding just to see people not only achieve their weight loss goals, but just to see how much their overall health has improved after the surgery as well.
Exactly, and that's really the motivating factor for many patients to pursue it, is that we know that it can, reverse so many of the comorbid conditions that come with the excess weight, and when people are set free from that, it's amazing. It truly is.
That's wonderful. Now, I know that our Center for Weight Control office recently moved, so can you talk a little bit about the new location and who is part of our Center for Weight Control team?
Sure. We've recently moved to the Liberty Building, which is across from the side of Morton Hospital at 91 Washington Street in Taunton, Massachusetts. And our center is pretty comprehensive. We have 3 surgeons. We have Dr. Adam Glasgow, we have Dr. Bruce Bodner, and we have myself all operating through this office. But we also have a tremendous amount of support staff. We have Janine Bento, who's our secretary here, who everyone will have the opportunity to talk to should they choose to call our center. She's amazing and is really good at scheduling everyone for appointments. We have Christine Smith, who's our program coordinator, who really has a very large role coordinating all the care for all our patients, tracking them through the system, making sure she's there to help anyone and everyone that needs it to get them to surgery, and then afterwards with all the aftercare. We also have medication options with Dr. Kajenki, who's our medical director, who can dispense medications if patients choose to go that way for weight loss. We also have dietitians. We have Lissa Petter. We have Melissa at the main Morton campus, and we have Peggy Poche, who also works with us at a separate office. And we also have a nurse practitioner, Natasha Martin, who works out of the Liberty Building, who helps screen patients preoperatively and postoperatively. So all in all, we have a very comprehensive team that's there for patients through every step of their weight loss journey.
Excellent. Well, it definitely, like you said, sounds like a very comprehensive team, but also a multidisciplinary team, which I think is really important when it comes to, folks who are going through the weight loss journey and having that multidisciplinary approach to caring for patients through our Center for Weight Control. So great to know we have all those resources nearby, and we can offer all of the testing and other support services needed by those patients. I have more questions for you, Dr. Pecquex, but we do have to take our first break of today's show. So if you'll stay with us, we'll be right back after these short messages with more with Dr. Nicole Pecquex of our Center for Weight Control at Morton Hospital. Stay tuned. We'll be right back.
We'll be back with more of Morton in the Morning in just a few moments here at WVBF.
Need a primary care provider? Morton Hospital and Steward Medical Group have recently opened 2 new primary care offices. SMG Primary Care at Paramount, located on Paramount Drive in Rainham off of Route 44, includes Dr. Nawar Najjar, Dr. Brett Stecker, Dr. Raquel Volney, and Dr. Ronald Volney. Specializing in internal and family medicine, they are now accepting new patients. To schedule an appointment, call 508-738-6740. And SMG Primary Care at Northwoods is now open and accepting new patients at Northwoods Medical Center on Bay Street with a full team of primary care doctors and mid-level providers and on-site access to a variety of specialists. To book an appointment, call 508-822-2266.
And now back to Morton in the Morning here at WVBF, Hometown Talk Radio.
Good morning and welcome back to today's episode of Morton in the Morning. We are today interviewing Dr. Nicole Pecquex, who is a bariatric surgeon on staff here at Morton Hospital, who has been with us for about 2 to 3 years now. We're talking about our Center for Weight Control, which just recently moved right across the street from Morton Hospital to the Liberty Medical Building, which is a beautiful new suite at 91 Washington Street. And we've been getting to know a bit more about Dr. Pecquex and also the Center for Weight Control team, because it's a full multidisciplinary team that supports the surgeons in caring for the patients and supporting them through their weight loss journey. Now, before we get into talking about the specifics of who might qualify for weight loss surgery, let's talk about the types of surgery that we actually offer here. You know, what surgical weight loss options do you offer here in Taunton? Or if someone needs, something else, are there alternative options in other locations?
So we're a comprehensive center for bariatric surgery, which means we can offer anything through this office. What we're doing currently is patients that are lower acuity, meaning people that have a body mass index, if you're male and have a body mass index under 55, you would be able to have a sleeve at Morton Hospital. Or if you were a female and had a body mass index under 60, you could have a sleeve at Morton Hospital. So Morton is really doing a lot of the sleeves that patients need in the Taunton area. If there's something that a patient needs that's more complex, like if a patient had a prior bariatric surgery and wants to convert to a different one, that's something we would take into Boston. Mm-hmm. Or if somebody wanted a gastric bypass, which is technically a little bit more complicated, we would do that in our Boston Center of Excellence. But the nice thing is that the majority of bariatric surgeries being done nowadays are sleeves, so the majority of those can be done right here in our hometown of Morton.
Okay. And what actually happens during the sleeve procedure?
Sure. With a sleeve gastrectomy, if you think of the stomach as kind of a football shaped, what we're doing is we're putting down a measuring device to measure out a very small diameter new stomach, if you will, and then we use staplers to carve off the extra stomach. So it's almost like a tailoring of your natural stomach, where we remove 2/3 of it, leaving you with a much narrower, tinier stomach, so you can eat much less, but will feel much more full when you do.
Okay, great. That's amazing. And you had hinted at this a little bit earlier in referencing Dr. Kajenki, but what are the non-surgical weight loss options that you offer? And does the center also offer any types of support services?
Absolutely. Before COVID struck, we used to have monthly support groups at Morton Hospital. We're currently working on creating virtual support groups online, so patients don't have to travel and don't have to have the COVID risk with doing that. So that's in progress. In terms of Dr. Kajenki, any patient that calls the program can select if they choose to have medication management or a surgical consult. And if somebody doesn't know what they'd like, they're welcome to choose either arm to kind of explore their options. Because sometimes people just need to come in and really hear what their options are to decide what the best thing is for them. So Dr. Kajenki specializes in medication management. Mm-hmm. There's 6 FDA-approved medications on the market currently that he can prescribe that help people by modulating different chemicals in the body to feel less hungry. So, and that's something where patients come in, they sit down with him, he takes a full history and physical and really tailors that choice to what the patient's needs are. And patients can cross arms. If a patient came in and started with medication management and wasn't happy after 6 months that they had lost enough, they could certainly decide to proceed to the surgical arm of the program. And we certainly have people that come in for the surgical arm and want to try giving weight loss one last attempt and convert over to the medical arm to see if they can do that on their own without the need for surgery. So we really just want patients to feel supported and that all their options are really on the table, and we're just here to help and advise them.
Sounds great, and it's wonderful that we have all those options available right here in Taunton. Let's talk about the actual, qualifications for weight loss surgery. So to our listeners out there who may be considering that as an option, who should consider weight loss surgery, and what are the qualifications in order to become a candidate?
So for weight loss surgery, most insurance companies nowadays go by the old National Institutes of Health consensus statement. And what that basically states is that anyone with a body mass index of 35 to 39.9 with at least one or two medical problems like diabetes needing medication, or sleep apnea needing CPAP, or high blood pressure needing medication, or elevated cholesterol needing medication, those patients mostly will qualify. If a patient has a body mass index over 40, then most insurance companies will qualify those patients for surgery without any additional comorbid problems. So you don't have to have the high blood pressure, cholesterol, or sleep apnea that you would if your BMI is lower. We do know scientifically that there is certainly, an indication for surgery with people with a BMI as low as 30 if they have uncontrolled diabetes. But unfortunately, a lot of the insurers have not changed their coverage policies, language to include those patients at this time. So that's something where we would work with a patient, even as low as 30, to see if we can, convince the insurer that it is the appropriate thing to do, because there's certainly literature to suggest it's very helpful.
Okay. Now, if someone doesn't know their BMI, I know there are tools out there online, but if they called your office, is there someone in the office who can help them determine if they're a candidate?
Absolutely. Janine at our front desk is wonderful at helping patients because she can actually enter online, what your weight and what your height is, and can calculate a number, which is your body mass index. Body mass index is your weight in kilograms divided by your height in meters squared. So most of us, if you're like me, say, oh my God, it's not in height in inches and pounds. That's much more complex. But that's why there are a lot of online apps that will let you kind of calculate that number. And once you have that number, you kind of know where you stand, because that number stratifies you into the different terms we use for obesity. Because your body mass index, once it hits 30, you get this label called obese. And once you hit a BMI of 40, that's considered morbid obesity. And no one ever wants to hear these terms. And I've certainly been to my primary care doctor, and these terms are thrown out, and you're not particularly thankful or enjoy hearing that. But it does, from a medical standpoint, help us kind of stratify, well, if you have too much weight on you, how much excess weight do you have, and how much do we need to help you? So trying to get past kind of the terminology and understand that this is just a way that medical people stratify how much excess fat tissue you have on your body is kind of helpful.
Okay, great. So let's say it's determined that someone is a candidate. Can you talk about a bit about the process? I mean, how does one prepare for surgery? Are there other tests that need to be done before the surgery is done?
Sure. So when a patient comes into the program, it takes about 3 to 4 months just to work them up for surgery. And when you meet with us for the first time, you get a very thorough history and physical, and then we determine, based on that interview and that physical and history taking, what testing you would need. So everyone will leave with a panel of blood work, which we get drawn, and that really looks at your baseline labs and gives us a kind of idea of what your nutritional parameters look like now before we do a surgery, so that we can, A, correct anything we need to now, but it also serves as your baseline, so going forward we can compare any data we get after your surgery to this preoperative data. We also will screen you for any heart disease in your family or in you. If there is any concern, we would send you to a cardiologist to be evaluated so we can make sure you're as safe as possible. We do routinely order an upper GI study, which really is where you go to radiology and drink some contrast, and they quickly take pictures of your esophagus and your stomach. So it's almost like getting a road map, so we can see what your esophageal length is, whether you have any hiatal hernia, or whether there's anything else we would need to do in the operating room for you to make your surgery highly successful. The other testing would be meeting with a nutritionist. Everyone meets with a nutritionist. They're really the backbone of the program. We really spend a lot of time working on how to change diets and a lot of education around foods, because if you're like any other person that walks in the United States into a supermarket, it's very confusing to try to figure out, am I doing low carb? Am I doing low fat? What am I supposed to be doing? And the nutritionists are wonderful at this, and they have so many tips and tricks to impart to people for healthy eating, because I have to admit, even, being a medical professional, listening to the nutritionists, I learn something every week from them.
I bet.
They're very helpful. Yes. Yep. So in addition to nutrition, patients would see psychiatry as well, and that's really a screening that has to be submitted to the insurer. That's a requirement. Mm-hmm. That's not something individual programs impose. So, and that just makes sure that everyone, if they have depression or anxiety or any other problem that would need to be optimized prior to surgery, that's well taken care of, and we can support you in the best way that we can.
Okay. Now, I've heard, and I asked this just because our Center for Sleep Medicine also moved into the same building that you are located now, but I have heard that another test that some might need to get is a sleep study. Is that true, and why is that?
That is true. A lot of patients that come in may have undiagnosed sleep apnea. Sleep apnea is basically when you lie flat at night, when you fall asleep, the soft tissues in your neck kind of relax and it occludes your airway. So it's not as easy when you're sleeping to get in that nice deep breath that's going to supply oxygen to your bloodstream and then to your heart. So a lot of our patients come in and they take many naps a day, and family members have told them they snore horribly and they can hear them through walls in the house. And that family members will actually go in and wake up these poor patients because they can't sleep because of snoring so loud. And those can all be symptoms of undiagnosed sleep apnea. So what we do is we'll screen every patient that comes into the center for sleep apnea with a screening tool we have, looking at what the circumference of their neck is and how they sleep and whether anyone's witnessed them stop breathing at night. Based on that, we will refer out for a sleep study. Sleep studies nowadays are not like they were in the olden days where people had to come into the hospital and be in the lab and sleep there overnight, because particularly with COVID concerns, everyone's concerned about that. But nowadays, the newer way to do it is you can visit a sleep medicine specialist, and they can set you up with a take-home test, if you will, where you pick up a kind of kit, take it home, and there are directions to apply it to yourself, like a little probe on your finger and some sticky EKG leads to put on your chest. And that will download overnight. There's a microchip in it that downloads your information, and then you just drop that box off the next day, and they'll run a report, and from that they'll be able to tell most of the time whether somebody has sleep apnea or not. Mm-hmm. If you have sleep apnea, we would then set you up with CPAP if you have moderate or severe sleep apnea, because we know that there's an actual survival benefit in setting you up with that. And if you get enough oxygen to your heart and lungs, you're obviously going to do a lot better than if you don't. So that's the whole purpose behind sleep apnea. But the good point is after surgery, a lot of patients will never need their CPAP again because they lose so much weight that they can sleep just fine without it.
Okay. And that's a good segue. So we talked about, who qualifies, what happens leading up to the surgery. Now, say someone has had the surgery. Talk about the recovery period and what that process looks like.
Sure. Well, all the surgeries we do for the most part are laparoscopic, so they're 6 tiny incisions. So everyone thinks that the recovery is going to be about 24 hours and they're going to bounce back to their jobs, but actually that's not the case, because with bariatric surgery you spend the first 2 weeks advancing through basically a liquid diet, giving all the staple lines time to heal and seal, and then we slowly advance you back to a regular diet. And patients can't do any heavy lifting for a total of 6 weeks, nothing over 30 pounds, because we really want to give the body time to heal so people don't form hernias or have increased pain from any of their incision sites. So most of the time what we tell patients, because that is a big concern, particularly nowadays with COVID and everything else, at least 2 weeks off from work, and we'll evaluate you in the office. If we feel you're fit to return to work, we'll certainly allow that by week 3. But if not, you may need up to 6 weeks to fully recover from surgery, depending on how your body reacts to it and how you feel.
Okay. And how much weight does the average patient lose as a percentage from receiving the surgery?
If your BMI starts at under 50, you're going to lose about 60 to 62% of your excess weight in a year.
Wow.
So, it's pretty impressive. If your BMI is over 50, that number comes down a bit to about 40 to 42% at the end of the year. But the sleeve can be used in multiple different ways. We can use it as an index surgery where that's the only surgery you're going to have or need, or we can do it in very high-risk patients that come in with very high BMIs where a bypass wouldn't technically be doable at the beginning. We can then take those high-risk patients, do a sleeve, allow them to lose weight over the first year, and then when they're at a lower weight and safer to proceed to bypass, we can then convert them. So the sleeve is a versatile tool that allows us to stage a procedure or give it as an index surgery. So it's a great surgery.
Okay, great. Well, thank you for walking through every step of the process. So we are actually approaching the halfway point of today's show, which means it is time to take our second break. Before we do, I just want to point out that all this great information that Dr. Pecquex has shared, we do have a summary of some of our weight loss surgery services on our website, mortonhospital.org. If you click on our services and go to weight loss surgery, you can learn more about some of those procedures that Dr. Pecquex has been talking about. You can see our brochure about our center, and you could also click on our BMI calculator tool. We have one right there on our website, and you can calculate, your height and your weight and find out your BMI. And that's actually powered through a BMI Calculator USA. So the direct URL for that, if you want to go right to it, is bmicalculatorusa.com. But again, it's right on our website, mortonhospital.org. We are going to take our break now. We'll be right back after these short messages. Stick around because we do have more with Dr. Nicole Pecquex of our Center for Weight Control. We'll be right back after these short messages.
We'll be back with more of Morton in the Morning in just a few moments here at WVBF.
When choosing where to go for your health care, quality and safety matters. That's why Morton Hospital is one of the safest choices for you and your loved ones. Morton Hospital was recently awarded an A grade for achieving the highest national standards in patient safety from the Leapfrog Group's Fall 2020 Hospital Safety Grades, recognizing our commitment to protecting our patients from harm and providing safer health care. Learn more at mortonhospital.org.
And now back to Morton in the Morning here at WVBF, Hometown Talk Radio.
Good morning, everyone. Thanks for hanging in there as we took our mid-show break. If you are just joining us, we are actually replaying a special episode of Morton in the Morning today, and it's an interview with Dr. Nicole Pecquex, who is a bariatric weight loss surgeon here at our Center for Weight Control. And we're replaying that interview because very timely news we just received over the weekend is that we have received official accreditation as a bariatric surgery Center of Excellence from the American College of Surgeons. So we're so excited and so proud of our team. It's a wonderful designation that acknowledges the quality of our weight loss surgery program here at Morton Hospital as we continue to grow that program, and it really positions us as a destination for weight loss surgery. We have a very comprehensive program here, which is now accredited, and we couldn't be more proud. So today we are replaying an interview that we recently did with Dr. Nicole Pecquex of our bariatric surgery team. So thanks for listening in. Let's get back to the interview. Good morning and welcome back to Morton in the Morning. Today we have been interviewing Dr. Nicole Pecquex of our Center for Weight Control, which is located in the Liberty Medical Building across the street from Morton Hospital. We've heard a lot of great information about our Center for Weight Control and the services offered. You know, Dr. Pecquex talked to us all about leading up to surgery, who's qualified, what the actual surgery looks like, and what the other options are through our Center for Weight Control, and also what the recovery time looks like. So we do have a few more questions for Dr. Pecquex, but before we go back to that, I do want to share a couple other provider-related updates that are related to our Steward Medical Group practices. The first is that Dr. Irma Rasmussen will be moving from our SMG Mill River Internal Medicine practice, which is right down on Washington Street. Her colleague there, Dr. Montero, actually retired back in December, and Dr. Rasmussen will actually be joining the SMG Taunton Medical Team, which is located right on 54 Court Street. So just about a block away is where she'll be moving to, and she'll be joining the SMG Taunton Medical Team, 54 Court Street. So that is great news, and her first day there will be February 23rd. So if you want to learn more about the SMG Taunton Medical Office, you can call them at 508-821-2500. And then the second announcement has to do with Dr. Bertrand Chapman, who has been in our community for many years now in the Middleborough community. And Dr. Chapman will also be retiring from the practice effective March 31st. So he is grateful to his patients for their support and loyalty, and he's truly enjoyed caring for all of the patients in his community over the many years that he's been part of our team. But the good news is that office will remain open for your continued care. So Dr. Jack Karishian and the PA in that office, Violetta, will continue to care for their patients as well as accept patients of Dr. Chapman's following his retirement. So if you have any questions, feel free to contact Dr. Chapman's office. And we want to thank Dr. Chapman for his many years of service to our community, and we want to wish him well in his retirement. So let's get back to our interview with Dr. Pecquex in the final segment of that interview. So far, we've heard a really great summary from you, Dr. Pecquex, of how the weight loss journey works through our Center for Weight Control, from, who's a qualified candidate, what does your BMI have to be, what are the steps you have to take in order to receive the surgery, what are the surgical and medical weight loss options, and what does the recovery period look like. So we've heard a lot of great information for you, which I want to thank you for. Earlier in our discussion, you mentioned that we had done a survey to apply for our Center of Excellence designation. So just for our listeners, what does that designation mean? And are there certain things that we have to have in place through our program to achieve that designation?
Absolutely. It's a certification given out by the American College of Surgeons and our Bariatric Society. And basically it's a site visit every 3 years where our societies really care that we're giving high-quality care to our patients, and they will not put their logo or allow us to use their logo until they certify each facility has the tools they need and the staff they need to take outstanding care of patients. So they will come down, they'll look at all the equipment we have, they'll look at the protocols we have. It literally takes them an entire day to interview all the staff, to make sure our equipment is up to par, our weight limits are up to par, that we have the appropriate protocols in place, and that we follow best evidence in the literature to make sure that patients get the best outcomes possible.
Great. Well, hopefully we'll look forward to receiving that designation very soon.
We certainly hope so.
So after hearing all of this, as someone in the community, would like to explore weight loss surgery a bit further, what is the next step? What should they do?
Sure. Well, a lot of patients can call the office directly, and Julie, I think you have the number because I don't have it in front of me.
Yes, I will share it right at the end of our interview.
Perfect. So basically with that number, you just contact us and we will schedule a visit right away, and you don't necessarily have to want surgery. If you're simply interested in weight loss, you can give us a call and we'll see what we can offer you and try to get you the best result we can. So I don't want people thinking that the second you call the number, everyone is shunted to surgery, because surgery is not right for everybody, and we certainly want to evaluate everyone and make the best choices and help them with their weight loss journey.
Okay, wonderful. So lastly, as a surgical director for the Stewart Centers for Weight Control, you are doing surgeries, like you mentioned, in the community setting as well as in the city. So I'm just curious what you've enjoyed most about practicing in the community setting like the one at Morton Hospital.
I love being at Morton Hospital because there's an intense sense of community, and because I also grew up around here, so I know it very well, and I've been very fortunate to work with some amazing people at Morton Hospital. And I think one of the wonderful things about Morton is how out of the way people will go from the second you enter. Security staff, front desk, nurses on the floor have been amazing to work with, and everyone's so has the patient's best interest at heart. And that is just, it's touching, and it really makes me want to come back every week. It's really wonderful to see.
That's great. And you just reminded me of one thing that, I didn't touch upon, but I think it's an important piece of the whole program is the care by the staff here at the hospital. So are there specific, units or departments here at the hospital that are more significantly involved in caring for bariatric patients after the surgeries?
Absolutely. We have some amazing nurses on S1 at Morton Hospital who have done, extensive training. They've been through the preoperative and postoperative pathways. Our OR staff is amazing. The techs in the room, the nurses in the room, they do it's a designated team. They're doing all our sleeves. They know exactly what we need, and they're such amazing, compassionate care. And a number of our staff have had the surgery themselves and often will volunteer that information to patients to kind of ease them through their journey and know that there can be a really nice outcome on the other side.
That's great. And this has been a wonderful interview. Thank you so much. A lot of great information. You mentioned that you learn from the nutritionists all the time, but I think we all just learned a lot from you as well. So in closing, is there anything else you would like the community to know about what our program has to offer?
Yeah, I'd like everyone to know most patients spend about 3 to 4 years researching, weight loss surgery, because when people start thinking about it, usually it's because your primary care has said something to you and you feel awkward and that somehow you've let yourself down and you haven't taken care of yourself, when in reality there's this stigma out there that patients with obesity and morbid obesity are kind of lazy and just don't want to do the right thing, and that could not be farther from the truth. I've seen people struggle for so many years, family members included, and it's a genetic predisposition. This is no one's fault. Mm-hmm. We don't fault people for having heart disease or other issues, but we do tend to fault them as a community is for weight, and that shouldn't be. So really our goal at the Center for Weight Control is to make people understand you shouldn't be embarrassed to come in. You shouldn't be frightened to come in. We are simply here to help you. We understand this is a genetic predisposition. This is no fault of your own, and we simply want to help.
Great. Well, again, I want to thank you so much for your time. A lot of great information. We're so happy to have such an incredible team here at our center right here in Taunton. Dr. Pecquex, thank you so much, and hopefully we can talk to you again soon.
Thank you so much, Julie. I really appreciate the opportunity.
Excellent. Take care.
You too.
All right. Well, thank you again to Dr. Pecquex for taking the time to chat with us and share so much great information about our Center for Weight Control and what the weight loss surgery process looks like. So again, that office is located across the street from Morton Hospital in the Liberty Medical Building, which is 91 Washington Street. And we have 3 bariatric surgeons who are seeing patients out of that office and also performing surgeries right here at Morton Hospital. So if you would like to learn some more information, or if you're interested in finding out if you're a candidate for weight loss surgery, you can call the office and talk about scheduling a consult with the office staff. And the number there is 508-301-2434. Again, that's 508-301-2434. 2434. And as Dr. Pecquex mentioned, they have a great team, a full office staff who is always willing to speak with you and answer any questions you may have and get you set up with an appointment as soon as possible. So that wraps up our interview portion of the day. When we come back, we do have some additional updates from the hospital side, but first we have to take our final break of today's show. So stick around for our final segment, and we'll be right back after this short commercial break.
We'll be back with more of Morton in the Morning in just a few moments here at WVBF.
Need a primary care provider? Morton Hospital and Steward Medical Group have recently opened 2 new primary care offices. SMG Primary Care at Paramount, located on Paramount Drive in Rainham off of Route 44, includes Dr. Nawar Najjar, Dr. Brett Stecker, Dr. Raquel Volney, and Dr. Ronald Volney. Specializing in internal and family medicine, they are now accepting new patients. To schedule an appointment, call 508-738-6740. And SMG Primary Care at Northwoods is now open and accepting new patients at Northwoods Medical Center on Bay Street, with a full team of primary care doctors and mid-level providers and on-site access to a variety of specialists. To book an appointment, call 508-822-2266.
And now back to Morton in the Morning here at WVBF, Hometown Talk Radio.
Good morning and welcome back to the final segment of today's Morton in the Morning show. Today we had a great show with Dr. Nicole Pecquex, who is a bariatric surgeon here at Morton Hospital, practicing out of our Center for Weight Control that just moved across the street to the Liberty Medical Building, and she has two other colleagues, bariatric surgeons who are performing surgeries here at the hospital, Dr. Bruce Bodner and Dr. Adam Glasgow. So we are so fortunate to have that team. A lot of great information was shared about our center. And then just a reminder, I did share their phone number before the break, but if I will share it again for anyone who missed it and who may be interested in learning more about our Center for Weight Control or finding out if you are a candidate for weight loss surgery or any of the medical management weight loss options that they offer through that office. So the office phone number is 508-301-2434. Again, that's 508-301-2434. And as I mentioned earlier in the show, you can also find some more information about our weight loss surgery program on our website, mortonhospital.org, and go to our services page to find our weight loss surgery information. And as I announced earlier in the show, after much hard work by our bariatric team, which includes Dr. Pecquex and the surgeons, their whole office staff, and then everyone from nurses, nutritionists, and support staff here at hospital, everyone has worked so hard to grow and enhance our bariatric surgery program here at the hospital. And because of all of their hard work, we got some great news over this past week, which is that we are now officially accredited as a Bariatric Surgery Center of Excellence by the American College of Surgeons. So congratulations again to our team, and we are so fortunate to have such a wonderful program right here in Taunton. So before we end our show, I will share some general updates about what's happening here at the hospital. So this week we actually are celebrating a few different healthcare recognition weeks. So we are celebrating Health Information Professionals Week, which is all of our medical records team. We have so many different team members who do a variety of work, but most importantly, they make sure that information is available to our staff, but also that patients' information is always protected. They manage a lot of documentation every year, medical records, and everything else, and just a great team who works so hard every day. So happy Health Information Professionals Week. It is also Medical Laboratory Professionals Week, and here at Morton Hospital we have quite a large lab and many different areas of expertise within our lab, from phlebotomy to chemistry to our blood bank and many more areas. So a great team there who does amazing work. They are also an accredited program here at the hospital, like our Center for Weight Control. We are accredited by the College of American Pathologists. So happy Lab Week to our wonderful team here at Morton Hospital. Another week, it's Volunteer Week. So that isn't just for healthcare, but Volunteer Week across the board. So we are very fortunate to have some incredible volunteers here at the hospital in areas such as, pastoral care, as well as general volunteers who help out in various areas in the hospital. So thank you to our volunteers who dedicate their time and their talent. And then lastly, it's Administrative Professionals Day, and that is actually today. So Wednesday the 21st, today is Administrative Professionals Day. We want to thank our administrative professionals both here within the hospital as well as those who work in our affiliated medical offices out in the community. So thank you to those groups for all you do for our patients and our team every single day. Coming up next week, related to our Center for Weight Control and our bariatric surgery program, we are having a virtual weight loss info session and support group, and that is free and open to anyone in the community who would like to learn more about the medical and surgical weight loss options available at our center. So it's next Wednesday, April 28th from 3 to 4 p.m. And during that presentation, you'll hear about our program, but you'll also participate in a discussion about how to combat negative thinking throughout your weight loss journey to help you get to your goals. So that program, again, is virtual, and how you sign up is you can go onto Eventbrite. Our program is listed there if you search for Morton Hospital Weight Loss Info Session. You can also go to our website, mortonhospital.org, and click on the Events and Classes page, and that will bring you to our upcoming events as well. Or you can call our Center for Weight Control. Again, the number is 508-301-2434 for more information. And again, that program, it's a free virtual weight loss info session and support group next Wednesday the 28th from 3 to 4 p.m. and that will be held via Zoom. So when you sign up, you will then be sent a link following your registration with the Zoom details so you can participate online. So a couple other announcements. We just this week have updated our visitor guidelines here at the hospital. We're working very hard to make sure that our patients can have visitors when it's appropriate. We know it's important for their health and their well-being and their healing. So just as of this Monday, we have updated our designated visiting hours. So prior to this week, we had specific hours of noon to 2 and 5 to 7 daily. But now, as of this week, our designated visiting hours are every day from 11 a.m. to 7 p.m. only. And now there are, of course, some exemptions to that rule for, patients who may be on hospice care or who have other approved visitors outside of those designated time frames. But for general visitation, it is every day, 11 a.m. to 7 p.m. We only allow one visitor at a time, and that's to make sure that we minimize the number of people coming through the hospital. Every visitor does have to be screened, and you have to pass our screening questions, of course, to make sure that we keep our patients and staff and everyone who comes into the hospital safe. And another new update is that if we have a patient coming in for a day surgery or to our pain clinic, we now have a large enough waiting area set up that we can allow a family member or loved one to accompany that patient up into our day surgery unit. But just one visitor with that patient if they would like them to go up, and we have plenty of seating up there. It's very socially distanced for everyone's safety. If you want to see some additional details about our visiting guidelines, because there are a few other exemptions and guidelines to follow, just go to our website, mortonhospital.org. And if you look at the top of the page, it says visitor restrictions in effect, and there's a little button that says learn more. If you click on that button, it will bring you to our page where we have a bunch of COVID-19 related information. Including the visitor guidelines, the latest visitor guidelines that we just mentioned. We have the information about our COVID-19 testing center, which, as if you've listened to a couple of our past shows or if you follow us on Facebook, you'll see that we do have updated hours for our testing clinic. We now do testing every Monday through Friday from 8 a.m. to 2 p.m. So those hours are listed there. We are closed on many holidays, and we were in fact closed this past Patriots Day holiday, and our clinic will be closed again on the next holiday, which is not until Memorial Day in May. So check out that page. There's a lot of great information, again, about visitor guidelines, about our COVID testing center, about how you get your results, some alternative testing sites, and then whatever updates we have from the state with regard to vaccination availability and eligibility. So that about wraps up today's show. We hope you enjoyed hearing again from Dr. Nicole Pecquex of our Center for Weight Control, one of our 3 bariatric surgeons now practicing in our accredited Bariatric Surgery Center of Excellence, which we are very proud of. Before we end, I just want to remind our listeners how you can contact us here at our show. We have a special email address set up for Morton in the Morning, which is mortoninthemorning@steward.org. That's MORTON in the morning at STEWARD.org. And we check that email every week. So if you want to send us any feedback, any ideas of things you'd like to hear about on future shows, or any questions that we can answer for you either via email or on air, we are happy to hear from you, and you can use that email address at any time. So that wraps up our show. Again, check out our website or our Facebook page for the latest information about what's happening here at Morton Hospital. And we hope you will join us again next week for more Morton in the Morning. Thank you so much for listening, and have a healthy week from all of us at Morton Hospital. When choosing where to go for your health care, quality and safety matters. That's why Morton Hospital is one of the safest choices for you and your loved ones. Morton Hospital was recently awarded an A grade for achieving the highest national standards in patient safety from the Leapfrog Group's Fall 2020 Hospital Safety Grades, recognizing our commitment to protecting our patients from harm and providing safer health care. Learn more at mortonhospital.org.